right, good morning, welcome. Today we're going to be talking about our work in Florida, looking at community engagement and prioritizing outcomes to improve family and child health in nurse home visiting. And we'll get started with introductions and get going. So my name is Venice Williams. I am a researcher at the University of Colorado at the Prevention Research for Family and Child Health, and so based in the Denver metro area. And I do mixed methods research and focus on maternal child health, home visiting, all that good stuff. So I'm going to let Denise and Jen introduce themselves, and we'll go from there.
Hi, I'm Denise Brown. I am a CLC. I'm newly a doula. I am a parent advisor, and I am a graduate of the Nurse Family Partnership Program.
Hi everyone, my name is Jennifer Marshall. I'm an associate professor of public health at University of South Florida, and I conduct maternal child health systems research and evaluation.
Perfect. Thanks so much. And now you know who we are. We'd love to get to know you a little bit better. So if our Justin could send out the polls, we have 2 poll questions to kind of get to know the audience a little bit better. The first question you'll see pop up here shortly is asking about what group you represent, best represent. We have a couple of different options here, and so feel free to maybe we didn't capture everything, so select other if you fall in this other kind of category. Just kind of helps us know and gauge our audience a little bit better. So go ahead and then answer the question there. All right, are we getting some answers, Justin?
Yes, we are.
Awesome. Yeah, and if you're having issues with the polls, feel free to pop that in the chat. That's totally fine too for the other category. All right. Can we see the results? We didn't capture these very well, did we, with these option choices? Okay, so we've got a nice mix here. For folks who are the other category, feel free to mention what those are in the chat so we can have a better sense of that. That'd be awesome. We're going to move on to our second question, which is related kind of like geographically where you're located. And so I think the options should be like Western part of the US, Midwest, Eastern, Southern, or other. Hopefully we have better options here for you all. But again, if you are other, feel free to pop that in the chat as well. Ooh, we have a home visiting nurse with us, a couple of them. This is wonderful. Okay, perfect. All right, let's see where you all are located geographically. Again, really a nice mix here. All right. Sounds great. Thank you so much for answering those questions. We'll go ahead and get started. So quickly, we want to acknowledge the rest of our team. There's 3 of us presenting today, but of course, this takes a lot of effort and expertise from a lot of different individuals. So just quickly wanted to acknowledge our evaluation team at the University of Colorado, our advisory board, which Denise and Jen both sit on, for our expanded eligibility initiative for Nurse Family Partnership in Florida. Of course, our local implementing agencies are local programs that implement NFP in Florida. Couldn't do this without them. And our partners at the National Service Office for Nurse Family Partnership and Child First, and that the funding for this work comes from the National Service Office as well. So Our agenda for today, we'll go through some quick learning objectives, and then Denise is going to kick us off with, for those of you who might not be as familiar with NFP, a quick overview about the program, a little bit more about the expanded eligibility initiative that's happening in Florida right now. And then Jen is going to speak a little bit about the recruitment efforts and how we have been engaging our advisory committee members. And then I will follow up with the process we went through to prioritize outcomes to evaluate our expanded eligibility initiative. And then all three of us are going to reflect a little bit about our experiences and share some lessons learned, and then hopefully have some time for some questions from you all. So feel free to use the chat for questions. There's also the Q&A option if you prefer either one, and we'll try and see how many questions we can get to throughout today's presentation. So our objectives for today's workshop are threefold. First, we will describe the process that we went through to recruit and engage individuals for our advisory committee that is diverse in nature. Second, identify the key outcomes that have been prioritized through our advisory committee. And then third, to apply key lessons learned to better engage community members within an advisory committee setting. And so if you're able through the chat box, we're really curious, just right off the bat, what are maternal child health outcomes that are most important to you in the work that you do? And we'll kind of tie that back at the end of our workshop. So feel free to throw that into the chat as we get going. So without further ado, I'm going to pass things on to Denise.
So thank you so much. So the overview of Nurse Family Partnership. Nurse Family Partnership is an evidence-based home visiting program designed to support first-time mothers and their children up to age 2, which I was a part of and was very grateful. NFP empowers first-time moms to transform their lives and create better futures for themselves and their babies. NFP works by having specialized educated nurses regularly visit young first-time moms to be starting early in the pregnancy. Guys, I'm sorry, forgive me. And continuing through their child's second birthday. The program goals to improve pregnancy outcomes, improve child health and development, improve economic self-sufficiency for the family. The expectant mom benefits by getting the care and support they need to have a healthy pregnancy. At the same time, new mothers develop a close relationship with their nurse, who becomes a trusted resource they can rely on for advice, or everything from safety, caring for their child, taking steps to provide a stable, secure future for them both. Through the partnership, the nurse provides a new mom with the confidence and tools they need, not only to assure a healthy start for the babies, but to envision a life of stability and opportunity for success from both mom and child. And let's not forget families. Nurse Family Partnership really goes all out for families, and they're there to support the dad too at any cost. When I was in Nurse Family Partnership, we had homework for my child's father at the time, who is now my husband. We'll talk about that later. NFP evidence. NFP is evidence-based community health program with 45 years of research and showing significant improvement in the health and lives of first-time moms and their children affected by social and economic inequalities. Next slide, guys. Sorry about that. So they expanded this initiative in Florida, and it was for multips, which are people who have previous live births, late registered. They enroll after 28 weeks of gestation. Usually NFP tend to get the moms early in their pregnancy, before 28 weeks. we have at this time, we have 172 late registrants and 135 multips. Some are combinations of both. We have 3 sites, North Central, Hillsborough, and Broward, that's participating in the full initiative. And we have 7 sites, Southwest Florida, Miami-Dade, Palm Beach, Treasure Cove, Northeast, Gaston, and Highlands that are participating in late registrants. The remaining sites are not participating at all, and only 1 site of 11 dropped out, which is awesome because that's a lot of data for you guys to collect, and it's a lot to ask for the nurses to put so much more on their plate, but awesome work. Next slide, guys. So why multips and late registrants? They should have had this when I was in the program. But people who, the pilot was with multips through 31 NFP sites across the country. Due to the community needs, demand funders who are interested in the feasible outcomes. What difference would having multips in the program do? What does delivering NFP what does delivering NFP with multips look like? What program is what programs are I'm sorry, I lost my place in my notes, guys. So basically, what do they need to support them, and what else is needed for the multip mothers? We learned a lot, but still have some knowledge and gaps. So this is why they're doing the run in Florida. Next slide. Oh, that's not me.
All right. Thank you, Denise.
Sorry, guys.
No, thank you. Perfect. Wonderful. So the Florida project, as Denise was saying, why Florida? It arose from this opportunity in which some of the Florida NFP programs received CAPTA funding from the Child Abuse Prevention and Treatment Act to expand their programs, and particularly for families who are impacted by substance use disorder or child welfare involvement. And we had University of Colorado had done this previous pilot work we just heard about, and had an evaluation plan framework in place. And then Florida also has this really unique universal prenatal and infant risk screen that collects information from nearly all the families in the state, and connect families to local home visiting programs and other supports and services. And the program is actually called Connect. And so we have the Healthy Start data, that central intake and referral data. And then we also have, of course, vital statistics data and other data available to help with that evaluation piece. And particularly in Florida, we have really strong, grassroots collaboration and passion for maternal child health and strong networks. So there was really a willingness and amazing home visiting programs that were going to take this on. So next slide. So from January 2021 and still ongoing, the project has, the goal has been to describe these participants, these late registrants, the multips, the family and their enrollment characteristics, and also to determine how Those families' experiences in the program might differ from traditional participants who enrolled for that 28 weeks. And then also to explore the use of those data sets to be able to evaluate outcomes for those families, because it's always challenging to have to find some sort of a comparison group. So the next slide. So we're going to talk a little bit about the advisory board. The whole project is evaluation is guided by an advisory board that was recruited through those networks I just mentioned. There's Family Partnership, the Manager of Nursing Practice, through the Florida Association Healthy Start Coalition, through word of mouth. Many of us work together at Maternal Child Health. Every member of the advisory board is compensated $50 an hour for their time. And there's also, and that compensation would equate to, say, for a parent, $25 for their time and $25 for childcare support, or to support their other participation expenses. And parents also receive technical resources if they need that, like a webcam, tablet, something like that, if they need that to participate, since we meet primarily virtually. And then there was a really nice onboarding training process for parents, participants, and also just for the whole advisory board, so we all start out knowledgeable about the project and the program. Next slide. So who's on the board? The advisory board consists of the University of Colorado, the evaluation team, Venice and her co-workers, 2 people from the NFP National Service Office, so that's the Manager of Nursing Practice who supports implementation, and also the Manager of Health and Government Affairs who supports that policy legislation piece. And then we have 2 moms and 1 dad, so you've met Denise as well. Participants of NFP, former participants with similar programs. We have a member from the Florida Department of Health, Department of Children and Families, the Association of Healthy Start Coalition, and then 2 academic partners. I am from College of Public Health, and we also have a partner from Florida State University. So both of us have done a lot of evaluation of home visiting programs and other maternal child health programs and systems. So that's who we are. Next slide. So what do? We meet regularly to discuss, to reflect, to guide the project, to weigh in, help make decisions about where to go with every step of that, which includes defining the outcomes, what's meaningful to families, and what's meaningful to maternal child health. So thank you all for sharing your ideas in the chat. We'll revisit that, and that's something that we've spent a lot of time on. We'll hear about that more today. We also identify data sources. So some of us really know that Florida population data, maternal child health data, what the landscape looks like, what access is like in our state for developing those data use agreements and accessing those data, and the quality of those data. And then really important will be supporting, providing that interpretation and sense making from the results of the evaluation, and supporting the next steps, the so what, the dissemination of the findings. So that's what we do. Next slide. How we do this, I think, is pretty cool. The University of Colorado set up a really great infrastructure and process for the advisory board. They began with outlining the parent rights and responsibilities, really, actually everyone's responsibilities. We have a co-developed group charter, which is kind of a set of ground rules, and we all complete agreements to participate as well. The charter has things in it life. We agreed to clearly communicate, to share our ideas, to listen to others' ideas and respect one another, to engage and attend, to really show up and be present, to stay focused on tasks, and also to be flexible. We have monthly Zoom meetings. They're consistently scheduled. There's a consistent agenda. There are outlined tasks for each meeting. And then there is follow-up after each meeting. That's also, I think, in our charter. And in between. So we have the ability to follow up with giving that input that we talked about. So we use tools like Jamboard, idea boards, surveys, and we can share the links to those as well if you're interested. I think next slide is Dennis.
Thank you, Denise and Jen. Appreciate it. That was awesome. And so I'll dive in a little bit about kind of the process we went through to prioritize and identify outcomes of shared interest between the advisory committee to evaluate this particular initiative in Florida. And so we used what's called a modified e-Delphi method, just fancy way of saying some sort of consensus technique. And it's because we did everything virtually, you know, with COVID. Most of this was done during still COVID times, which we still are technically in. And then using surveys and so forth. And so for those of you who are less familiar with the Delphi method, it's just basically a way to build consensus by collecting information and perspectives from experts in a systematic way, and then also allows for discussion and also in some ways reserve anonymity as well during that process. And so, like I mentioned, we started this work during COVID. So last fall through this winter, and we had 3 rounds of data collection using an online survey, and then held several consensus discussion meetings via Zoom. And so I'll walk through this process here over the next few kind of slides. In our first round of data collection, we wanted to be really open-ended. We asked 5 questions that you see listed here, really trying to just get ideas from our partners in our advisory committee. Like, what are the characteristics of the families we're hoping to reach in our home visiting services? What are some measures that we're familiar with in terms of measuring how implementation is happening, or what are the impact or outcomes or effects of the program longer term? But we also wanted to be a little more creative. We wanted to kind of, didn't want to restrict ourselves to just, this is what we always do, but think about potential new ideas or new measures that have not been measured in the past. And so we got all these different responses from our advisory committee members, and our evaluation team at the University of Colorado organized everything. So for each of these questions, we organized them by theme, and then shared these different themes and ideas with our advisory committee members. And so I'm going to share an example of what it looks like. We used idea boards, and there's a link at the bottom of our slides here, and then maybe Jen can also pop it into the chat if you can do that, please, that'd be great. But this is an example. This one is what the board looks like. It looks like a bunch of different Post-it notes organized by kind of theme, and so you can set this up to whatever topic you want it to be. But we felt this was a really nice way of kind of visualizing all the answers from the survey and grouping everything together. So for example, and looking at implementation measures, we grouped them into client enrollment, client engagement, retention, and then these other levels of types of measures at the implementation level. We had to be creative, and ideally, of course, we're all in a room together and we can have a big whiteboard and then put Post-its up and so forth. But this was what we could do with being virtual. And so after this first round of data collection, we had a second round where we had a more close-ended survey. And so from that first process, we identified 35 total outcomes. 18 are process, or what we'll call implementation or process outcomes. while 17 are more impact outcomes, which kind of looks at longer term effects of the program, and typically requires, like, from a research standpoint, having a comparison group. And so we asked our participants, our advisory committee members, to rank these 35 outcomes, each from strongly disagree to strongly agree, 1 through 5, on 4 different criterion, and looking at significance, which refers to potential impact on home visiting practice, innovation, which refers to exploring kind of new areas or creating new knowledge, relevance in terms of being important to the population that we support, and then feasibility, which is really based on the potential to access or gather data in a timely manner with limited funding. And so our advisory committee completed the survey, did this ranking, and then our evaluation team compiled the results. And so you're probably wondering how we kind of came up with, well, what do we do with this information? We created some thresholds. And so we created 3 different levels of consensus, essentially those that we would include, those outcomes that we would include, those outcomes we would exclude, and then this kind of gray area of non-consensus. And so you can kind of see the definition here on the side. But basically, if more than 3/4 of our respondents rated strongly agree or agree, so 4 or 5 on these different aspects for an outcome, we included this outcome for our evaluation. On the other end of the spectrum, if less than half of our participants scored a strongly agree or agreed, they were excluded. And then most of our outcomes, unsurprisingly, fell in this middle bucket. And so those are the ones that we ended up talking about and discussing in our consensus meetings. And so in these consensus meetings, we landed on 20 outcomes. So we did a little bit better. We narrowed from 35 to about 20, but we needed to narrow it even further because that was just not feasible for our timing and just for our resources. And so with these 20 outcomes, 9 being more implementation process oriented, 11 being more outcome driven or longer term impact, and went through 2 meetings on Zoom. And went through each one. We went through every outcome individually and gave opportunities for each of our advisory committee members to reflect on how they had ranked it in the past, kind of talk through, okay, what questions do we have about this particular outcome, and really document it as we're going through a process. And we used Google Jamboard as a way to document this. Again, being virtual, we had to come up with some more creative ways to kind of visualize everything. And Jen popped that link into the chat there. Those are just the generic links that you can use to create your own. But an example of what that looks like is you see shown here. This is looking at maternal physical health as our outcome, which is a longer term impact outcome. So it would require a comparison group. And also requires new data collection. And so the yellow Post-its that you see here kind of grouped are what came out of the discussion. So these are things that were ideas that came through from our discussion with our committee members, what questions they had, kind of how do we actually measure physical health? What are we talking about when we measure physical health? And through this discussion really helped to refine our final data collection process, which is round 3. So here is round 3, where we, again, used a closed-ended questionnaire looking at those 20 particular outcomes. And we asked everybody to rank these from lowest priority to highest priority. And so after all that discussion, hopefully it got people's brains flowing and juices flowing and thinking about what's feasible, what's significant, what's innovative, all those things that we felt were important for us to consider in prioritizing outcomes. And then eventually came up with another threshold. There's 2 bullet points here, but basically, if more than half of people identified a particular outcome as high or highest priority, we ended up including it in our final evaluation plan. And so without further ado, our final outcomes that we selected are twofold. So I'll first speak to our process outcomes or implementation measures. Is program reach. We want to know, among the individuals who are eligible for our program, are we actually reaching the people we want to be serving or supporting? And then client enrollment really looks at, based on the referrals we receive, how many clients are actually enrolling in the program. And then client engagement obviously refers to engagement in NFP and in the service. We can measure in different ways, whether it's, number of visits and the different phases and so forth. So those are 3 process outcomes. And then our impact outcomes. So we have 5. First is child maltreatment. And this one actually was identified from the very beginning as what 100% of our advisory committee members felt that child maltreatment was of greatest priority. So that one was included from the beginning. So child abuse and neglect outcomes, and then maternal physical health, which we are still in the process of defining what exactly that means and how we want to measure that. Maternal mental health and substance use, which is important, especially given what Jen said at the beginning. Like, part of how this initiative started was funding from CAPTA, which really focused on the population affected by substance use. And then birth outcomes, so referring to things like low birth weight and preterm birth, and that outcome is readily available through vital statistics. So we're excited to be able to look at that. And then finally, breastfeeding practices, which I know Denise is really excited about, since that's really her area of expertise. But I see that, in thinking and looking at the chat box here, we see, healthy mom and baby and focusing on certain populations, looking at, relationships. That's not something that necessarily came up for us in our final refinement, but then maternal morbidity outcomes are definitely something we're interested as it relates to physical health. So definitely see some alignment with the interest from folks who've responded in the chat there. But that was the process we went through to prioritize the outcomes for our evaluation. These are the outcomes we've landed on. We have another 1.5 years left to our project in terms of evaluation. So we're excited to be able to continue to work with our advisory committee and really continue to reflect on our learnings and our findings and utilizing their expertise to make connections locally in Florida. Since we are physically in Colorado, we really do leverage their knowledge and expertise. So we're going to spend the next, let's see what time are we? We'll spend the next 10, 15 minutes or so reflecting on our experiences on the advisory committee, share some lessons learned. I'll start by kind of sharing what our broader committee thought they've have thought about in terms of their experience. The word cloud that you see here are 1-word answers that we asked our committee to send to us in terms of like what comes to mind in terms of their experience so far. And so as you can see, parents is the big one. So parent engagement, having strong parent and family participation, those who can really speak on behalf of the population we're working with. Collaboration, so the collaborative nature of the advisory committee, engaging with local community partners who work directly with the population, who are passionate about maternal child health, early intervention, and home visiting. Diversity of thought as well as experiences, the inclusive approach to seeking alignment on the outcomes we're hoping to prioritize. So those were some of the major kind of reflections from our broader advisory committee. I'm going to stop share here for a second so you can see all of us a little bit better as we talk. But I'll start since I'm already talking. I know I've been talking for a long time, but it won't be for much more. So I was reflecting on my experience, and we started recruiting for this particular advisory committee 1.5 years ago, really in the midst of the pandemic. And I think what I've learned the most is the importance of trust and building trust, what that process looks like, and really identifying individuals in the community who are already trusted members. I think that was really helpful. Like having Jen on board early on was really great because Jen's done a ton of evaluation already for home visiting and other maternal child health initiatives in the state. And then getting Denise on board was awesome. Just to have that parent voice, has been so fantastic. For me, I'm a first-gen immigrant, first-gen graduate from college. And so it's always been important for me to engage with community, like elevating community voice is something that I've always wanted to do and participate in. So this was really the chance for me to do that. Other things that come to mind, I think, is thinking about how do you create spaces that are not just safe, but brave. And in terms of for people to reflect and share their lived experiences, I think has been a really great learning experience. I think it's about asking people what they want, what they prefer, and not just making assumptions, offering flexibility. We know that things come up, maybe you can't make it to every single meeting every month, and that's okay. Whenever you can participate, we'll take what we can get. I also think there's some kind of more logistic reflections being based out of a university. Like, what is it? How do we compensate our family and community partners appropriately? What is appropriate? What's the process to actually do that through a university system that might have maybe some potential policies that may not align with what you want to do? So going through that process of figuring out what's best for our participants and potential tax implications. I had never thought about that, what might that mean? And then finally, I think COVID in a way has been a blessing in disguise because created this virtual opportunity for us to engage and just people are more comfortable. I mean, there's Zoom fatigue, but people are much more comfortable with using these virtual platforms like we are today, engaging with you all. So I think in a way, it created that opportunity for engagement, people being in their homes and wanting that engagement with people from other places. So those are some of my reflections, and I'm going to just stop talking so some of our other panelists can share their experiences. And yeah, whoever wants to go next.
I'll chime in. My reflection is, wow, this process has been amazing and phenomenal. And to know that our voices as parents really do matter, and we're not stuck in a room, we're not just at a table just to be a head count. It matters. They want our opinion, and the change is happening because we're speaking up. This has been a phenomenal situation. And to actually speak on the relationships of the intimate partners, we know that we can't have engagement without having those intimate partners involved. So if we're not getting the partners involved, if we're not getting the moms involved or the grandmothers involved, we're not gonna get that engagement with the moms. So we have to make sure that we're involving them. And that was one of the biggest discussions that we had. This was so amazing, and I'm so happy that we still have a year and a half left. This is going to be so much more amazing. So guys, watch out. We are coming and we are breaking through so many barriers. It's going to happen.
Thank you. Yeah, I guess I've been part of a lot of advisory committees and boards, and many join, but few stay. And I think that Zoom fatigue is real. People like shut off their cameras and multitask or whatever that is. But this has been really different, and I think a lot of what has maybe made it different is just all the thoughtfulness and care that the facilitators have put into it, and plus who our membership our members are. So that diversity of members and perspectives, really all passionate, experienced, knowledgeable maternal child health people and parents and all of us. There's each meeting starts with an icebreaker, which seems really cheesy, but now I really like it. And but the purpose of that, if you could travel anywhere, things like that, is for us to get to know each other, and that's really key. So it's very friendly. It's not stuffy. It's not formal. So people are really, all of us are. It's fun. It's more engaging that way. I also like that there is this really strong commitment to equal participation. Our facilitators convey respect in all times. We all respect and expect each other to join the conversation. And again, the organizers of the group, take it really seriously. They take time to put in they've put the time in to, take the notes, send the agenda, do the follow-up. So it's very consistent and committed. And so when they're consistent and committed, it makes us want to show up and be consistent and committed. So those are the things I really liked about being part of this group. I can't believe it's been so long and fast, but it's really, really important work. And we're all here to just make sure that the families and our home visiting programs and providers, that this really makes a difference for them.
Thank you. Thanks so much, Denise and Jen. And it's going to make me cry, probably because I'm just dating. But it's been such a wonderful experience. I've learned so much through. It's very humbling. It's a very humbling process. And I think with that comes that respect and that love for each other. It's really about building those relationships, I think. And I think it's finding ways to do that beyond through the ethers, right? like I've never physically met either of you or the majority of the folks on our advisory committee. So I'm hoping there's an opportunity for that to come hopefully next year. But those are some of our reflections. And I think we have about 15 minutes or so. We'd love to just spend time with you all. What questions do you have for us? In terms of our experience. I had another slide of our email addresses, but I'm wondering if maybe we pop those into the chat instead, if you have questions for us. But yeah, go ahead, use the chat box, use the Q&A. You can also use the raise hand if you want to verbalize your question, if you feel that's your strength is verbalizing over writing. We can do any of that. And yeah, we're happy to answer any questions. We talked a lot. There was a lot of information, so it's okay to, ask any clarifying questions that came up, anything at all. So there's a question about outcome data. So we have started looking at our late registrants. But we are analyzing that data right now. So that wasn't we don't have any per se results from a quantitative standpoint right now to share. But in terms of our late registrants, we're hoping to share those results in the next 3 to 4 months. And then also from the multips, which is we've been trying to hone in on, focus on late registrants and then multips because we wanted to have a small group to start with. Multips, we're hoping to have some more data for by the end of next year because as Denise mentioned, we have just over 100 or so multip registrants, which really isn't enough for us to really look at impact. So that is to come. I see a question about if NMHIS is open to expanding multips or late registrants to other states, or is it too soon to say? Yeah, I think that's a very great question. Denise kind of mentioned this at the beginning of our formative study that we embarked on back in 2018, and this was for late registrants and multips, and there were 31 sites that participated, probably in the biggest pilot I've ever been a part of. And this was spread out across the nation. So that's what really started this entire effort is that particular formative study. And then from there, we show some early, good early outcomes that weren't compared to a control group. So, from NFP standpoint, where we're evidence-based, we didn't really have that evidence yet. But we did want to at least start seeing what things might look like in Florida, given that funding opportunity. And so I think there is an openness. That's really a question for the National Service Office. But I think there's definitely interest. And at the University of Colorado, we're actually just starting a randomized controlled trial looking at randomizing multip moms to NFP or not NFP. And that's going to be starting up in the next few months, over the next few years, where we're actually going to be able to have some real evidence, and that's taking place in Ohio. So I think there is an openness, but I don't want to speak for the National Service Office here, but there's definitely an interest, I think, based on community need from funders. So I think just being open to these different opportunities. Yeah. other questions? Denise?
As a graduate, when I told some of my friends that I met through NFP that they were opening NFP to multi moms, everybody says, I'm done having kids now. What is wrong with them? We loved NFP. They took a whole session with us to see what they needed, to see if they can provide us with anything else. And everybody was like, we just don't want the program to end. Why does it have to end? So now all of my mommies are like, but I'm done having kids now. And I said I was done having kids. But yeah.
Thank you, thanks, Denise. Appreciate that sharing. There's a question in the chat. I think that maybe if you're comfortable answering the question, it's with the makeup of the advisory board being a majority of agency staff and only 3 parent participants, did the parent participant feel fully comfortable at the monthly meetings to share and speak up?
Absolutely. So, first of all, most of us that are parent participants have either volunteered or worked with most of the people, that we have talked to on this board, or we were referred to the board via someone that we trusted, so we were comfortable. But there was rules at the beginning. There were set rules, and we went through these rules every time, that we were going to respect each other, that we were going to listen, that we were going to focus, that we were going to be attentive. So there was set rules that was in place, and it was spoken at each meeting. So, if you were not speaking out as a parent, it was like, kind of, come on, let me hear your opinion. And the fact of when we started speaking, you can see Venice taking notes, and she's like, oh yeah, I like that. Oh, I like that. It's like, oh, okay, well, maybe I should give her this other idea. So it makes you that much more comfortable.
Thanks, Denise. And Jen, I hope you're staying safe. That sounds scary. But
Florida.
yeah, no. It's that time of year. The other thing that Jen kind of mentioned at the beginning was the onboarding process we went through. So we did have 4 parents initially. Unfortunately, one did drop out. And so I think, that was a learned experience also. It's like, what are expectations and versus like reality? But just the onboarding process, we invited only the parent participants that we had and went through a couple, just like an hour, like a get to know you, like this is who we are, this is what we're expecting, what questions do you have? Provided some basic, for those who might not be as familiar with research and evaluation, going through some of those concepts. We also gave an opportunity that I think a couple of our parents, especially the dad, participated in, is called the fireworks training. It's that some other group created through PCORI funding for patient-centered outcomes research, and is a really great online tool for teens, for parents, for researchers to kind of go through and to learn more about what research and evaluation looks like, what does participation look like in these types of advisory committees. So we're hopeful that that provided some sort of foundation that made folks feel more comfortable. And then, so the question about what has the dad contributed to your group that you find most beneficial? Denise or Jen, do either of you have thoughts? I know I do, but I'll give you an opportunity first.
So Devin is very outspoken. He is, first of all, he's a single father who fought for custody. And he is amazing. And when he is not comfortable with something, and when he feels like something is like, I don't think that's going to fit, he's, in the most respectful way, but he's going to let you know. I don't think that's not quite right. Or how about we go about it this way? He's very, very respectful, and he is amazing. Like we live in the same place. Both of us live in Jacksonville, Florida, and I follow him on Facebook, or like I see him around town, and every time I'm seeing him in different organizations, he's in this organization, he's over volunteering over this way. So he cares about the outcomes of these babies and these moms and these families, and he wants the families to stay together more than anything.
And I think that to Denise's point, sometimes we get centered on the mom or one particular family member. We forget that families, come in all different forms, and we have, all the family members are really, really important. So I think it just having his participation helps us to keep that in mind, keep the whole family in mind, and just be open to diversity of families. So.
Yeah, exactly. Thanks, Denise and Jen. I think for me is it's that different perspective is the one you sometimes forget about being in working in maternal and child health. But really it should be family and child health, right? Which is why we titled our presentation Family Health and Family Outcomes. So we think it's that whole family unit, whatever that looks like for different groups and so forth. But I think it's also his personality. He tells you straight. he's very honest, but like Denise said, in a respectful way. But I think there's a lot of integrity between all of respect for one another, and just over the year as we've developed our relationship, we've just learned to we trust one another. We trust that we're being heard. We trust that what's being said is actually being integrated into the work that is being done and then shared back. It's not just like, okay, take it and run. It's like, okay, well, this is what we've actually done. Here's what we've adapted. Here's what we've learned. So I think those are just some other reflections there. Thanks, Jen, for popping in the fireworks training link also, in case folks were interested. It's free. We like free things. Everything we've shared is free so far. So any other questions for us? These have been really good, thoughtful questions. We appreciate it. I have a question for Denise and Jen, if that's okay, since I don't really see any in the box right now. Since, we have another year and a half left of our engagement on this advisory committee, hopefully more, if we get more funding. But what are you hoping to achieve over the next year and a half? Like what's your goal?
I think I'm hoping to start seeing the changes and the outcomes of getting the multi moms, providing those services to the moms that actually need it, because there's moms that have not been able to get NFP that really could benefit from it. And maybe it's the cutoff point at the 28 weeks that was getting them, or they have multiple kids. So I think that this would be amazing. And then hoping that, that it can spread more, more states can get this, because this is what we're doing.
Yeah, I think for me, coming from public health, with any program or initiative that I'm working with, I'm always really, really care about who's missing, who's not, able to access that opportunity or know about that opportunity. So any way to open up the support that home visiting has for families, I think is really important. But not just accessing, but that it's quality, and that there's equity in that quality and access, and that it's family centered. So I really like all of that. And as a researcher, I'm really excited to see what the outcomes are going to be, of course. But I also really like the way that we go about it. In Florida, we meaning our partners and the participating partners and projects like this, really try to to make those decisions together, to go through the process together. So I hope it continues to be community centered and family centered.
Thank you. Appreciate that. I'm eager to see the outcomes too. Being the data person, I like, we have the data. Like, can we just analyze it now and just like see what we're getting? So it's been a learning process. You know, all the data use agreements and all that has taken a lot of time for folks who are familiar with that process. It can take, you know, even for existing data, just to, like I said, developing those relationships, making sure you're talking to the right people. All that fun stuff takes time, and then working with different state agencies, you know, Department of Health, child welfare, so children and families and others groups. But we hope that sharing our reflections and our lessons learned and our experiences has been helpful for you and your work. And just special thanks to Denise and Jen for taking time out of their day to share these thoughts with us and co-present. Really do see this as co-design and co everything is really the intention. And so hopefully that came through today for our webinar participants as well. But Catherine has popped in our email addresses into the chat. If you have additional follow-up questions for us, we're happy to answer anything that you might have for this initiative and our process and our advisory committee. And appreciate all the well wishes for our work, and stay tuned for outcomes to come. And yeah, I think we're gonna give the gift of time back to you all for a couple of minutes, and hope you enjoy the rest of the conference, whether you're virtual or in person.